when the Affordable Care Act was signed into law, and yes, it was controversial, and I understand that. But if you think about healthcare since the inception of this country, healthcare has always been a controversial issue. But there was a statement made by my Republican colleague that said Obamacare is failing. Well, what I like to do is I like to clarify that that's not the case, especially in California. And if you look at healthcare in the Affordable Care Act, especially in the states who have embraced it, it has worked. And California has been a shining example of that. We have an exchange that has done some incredible work, one of the first in the state. We have decreased our uninsurance rate by half. We have maintained our rates as low or lower than any other state, and we've insured 1/3 of the population, despite the fact that we have some of the lowest reimbursement rates in the country in Medi-Cal. So I think what we should be doing is talking about using that as a floor and to expand upon that and make it even better. So I don't know what the Senate's going to do, the U.S. Senate's going to do, and what this resolution is saying is we ask that you take this into consideration. But let's talk about what's on the table right now with the congressional portion of it. This bill, in its current form, and I don't know what's going to come out, is the absolute biggest tax break to the wealthiest individuals in this country at the expense of working people and our seniors. And we have shifted away from a needs-based to an age-based. And you want to talk about Medi-Cal, as my good friend from San Diego says, I don't care how much money we would have brought over from Prop 56, that would have been a drop in the bucket compared to the block grant and the per capita rate that we could potentially get from the federal government if it passes. And I will tell you one thing, if it passes in its current form, the Medi-Cal system as we know it today, it's gone. And let me tell you, members, we talk about rates, we talk about access, it doesn't mean anything because you're going to have the absolute poorest people and the most needy in this country, in this state, that are not going to have access to health care. You're going to see premiums increase. There was also another comment made about selling across state lines. Well, guess what? We can do that already in the Affordable Care Act. It's in law. So I don't agree with anything that the federal government is doing right now, especially when it comes to the Affordable Care Act. But I will tell you this in close, that California has done an incredible job by implementing it. We're a shining example of what we should be doing. And if the U.S. Senate really wants to make a difference, they should follow California's lead, and we should use the Affordable Care Act, as the floor and not the ceiling, and only improve upon it.